In chapter 1, we begin with the history of dentistry. What is the purpose of recording history? Any answers? To make sure that history doesn't repeat itself if it's something negative. So the purpose of recording dental history is to learn from it and to make it better. And so we look at the different jobs in dentistry, dental public health, endodontics, oral and maxillofacial pathology, oral and maxillofacial radiology, oral and maxillofacial surgery, orthodontics and dentofacial orthopedics, pediatric dentistry, periodontics, prosthodontics. So in history, you'll look and see that a lot of times physicians did it all. Dentistry, amputating a leg, and then around the turn of the century, things started changing where people got into specific jobs, whatever they were passionate about, whatever they felt called to do for a specialty. And things got better when you went to a specialist. So today, if you're having open heart surgery, you wouldn't want a dentist to do it. You know, you'd want someone who specializes and studies just that specific area. One of the things that is not considered a specialty in dentistry is dental forensics, but it's becoming more and more popular. One of the most famous cases in dental forensics was the Ted Bundy case, where there was the bite mark. And so you see here, you have a dentist who takes his impression, which you guys have done, using alginate. They pour it up with plaster, and then they match the teeth marks to the bite marks. And this has been used quite a few times in different cases, whether it be child abuse or in this case, you know, multiple murders in people. So dental forensics is becoming very popular in the specialties of dentistry. This is a famous picture of George Washington. His dentist was John Greenwood, and he is the one that made the famous, what people call wooden dentures is false. It was made of gold, ivory, and springs, and there's a replica of it in the National Museum of Dentistry in Baltimore. What's unique about this picture is this is where we got that phrase, presidential pose. Does anybody know why he's posing like this? No smile? What? His teeth, well, his teeth weren't rotten. He only had one tooth in his mouth, a lower left premolar. And so what they did in this picture, John Greenwood stuffed his mouth full of gauze. So when you have an edentulous mouth, or in his case, just one tooth left in his mouth, your cheeks sink in. There's no structure support. And so in this picture, they had to make his cheeks go out so he wouldn't look so old. And so they stuffed his mouth full of gauze, and this is the picture you see on the $1 bill. And I always laugh when I look at that. So a lot of presidents after this did that presidential pose, and they used to call them party teeth. So John Greenwood did make him dentures. I don't know if it was at this point where he had them or not, but I know for a fact that in this one he wasn't wearing them. And so they made them of gold, ivory, and springs. And I'll show you some in the upcoming photos where you'll see some different types of dentistry that was used. Different clubs, if you will, in dentistry, professional development. ADA stands for American Dental Association. ADAA, American Dental Assistant Association. ADHA, American Dental Hygiene Association. and NADL, National Association for Dental Lab Technicians. And so if you're looking to increase your knowledge and education about dentistry, they have different chapters depending on where you live. And I know here we have several Richmond chapters, different chapters in Chesterfield, and you can join and you get together with other dental assistants and talk to each other about what do you do for this procedure, what do you do for that procedure. And all of that is taking your history, your knowledge, and bringing it to the table to be able to work with each other and learn from that. And the whole point is not to boost your salary and boost your knowledge for your resume, but to help the patient, which is what the dental assistant creed is all about. Danby stands for Dental Assistant National Board. You take all your knowledge, you take all the education that you've worked so hard for, and you sit for this test, and you become a certified dental assistant. The basic point of this certification is any dentist that sees that you're Danby certified is going to know exactly what you know. And so, and yes, it will, if you're certified, it will help build your resume. That's all great. But what is our number one purpose when we walk into the office? To be there for the patient, right? Specific instructions and objectives: review the dental disease from the beginning of time. Hesse Ray was recorded in 3000 BC. Aristotle and Hippocrates write about tooth decay. 460 to 377 BC, the Hippocratic Oath is formed. So there's lots of names that you've heard before in your regular history class, correct? When I went over to Greece this past summer, I even heard them talking about Aristotle and Hippocrates. And so that's where we get the Hippocratic Oath from. And so when you look through chapter 1, you'll see a whole list of different things that, you know, kind of stand out. Tooth morphology is identified in 1452. Josiah Flagg develops the first dental chair. And so if you go to the National Museum of Dentistry, you'll see these things set up in rooms so that you can kind of get a picture of stepping back in time. And so there's also a really cool thing. I don't know if y'all have ever watched the movie Tombstone. I love the movie Tombstone. Doc Holliday, who is played by Val Kilmer, he was born with a cleft lip, and he ended up becoming an oral surgeon. And back then they didn't have gloves, so he actually caught tuberculosis from one of his patients. And so he moved out to the Midwest where the air was lighter, easier to breathe. And back then, if you had tuberculosis, they called you a lunger. It's because it was a breathing issue. So he moves out there, and if you like Westerns and you like older movies like that, he ends up becoming friends with Wyatt Earp, who is a famous gunslinger officer. And so anyway, they would run out the cowboys, which were the bad guys. But chapter 1 talks a little bit about that. They actually sell a book at the National Museum of Dentistry about the life of Doc Holliday. It's a great book. Here are some interesting artifacts from ancient dentistry and orthodontics, how they would take some of your teeth that had been pulled or fallen out, and they would just wire them back in. And it used to be, in ancient Egypt, they thought if your tooth hurt, then there was a worm inside of your tooth. And it was some type of sin that you had done to aggravate the worm, and it was eating the inside of your tooth. And so they would actually drill holes in the teeth to get these worms out, but in the process, killing your pulp. And so again, the importance of recording history to make sure we don't repeat that, right? Anybody want that done to them? I don't think so. This is James Morrison, the first known dental foot engine. So he designed that, and you look at our chairs in here at our high speeds and how everything's air driven, just how far we've come. So this is Paul Revere, and Paul Revere, I always forget his name because I want to call him Jack Black. Does anybody else think he looks like Jack Black? He is very famous for being a silversmith, but also he used that to create a lot of our surgical instruments we even use today. And so he's noted for being the first in marketing dentistry in the Boston newspaper, which is really neat. But he created so many different things in dentistry and worked with so many people. And one of the things that we see here in chapter 1 is the dental assistant pledge. And so we're going to read that. And I'm going to grab my glasses real quick so I can see it through it. But it says here, I solemnly pledge that in the practice of my profession, I will always be loyal to the welfare of the patients who come under my care, and to the interest of the practitioner whom I serve. I will be just and generous to the members of my profession, aiding them and lending them encouragement. So many times I see dental assistants in an office not helping each other, trying to be the doctor's favorite, and making fun of them if they don't know how to do a procedure exactly right. And what you should be doing is looking back to this pledge where it says you're going to offer encouragement, not try to cut each other down. And that's the same thing I want to see for the class. I want to see people encouraging each other, and if they're not doing it right, help them out, show them how to do it. I hereby pledge to devote my best energies to the service of humanity and the relationship of life to which I consecrated myself when I elected to become a dental assistant. So this is a conscious choice that you make. Your job this year is to learn your clinical skills, your lab skills, get used to working on patients, gain knowledge from lectures, and reading your notes, books, and handouts.